Section 3 provides an overview of mitigation, in theory and in practice, and highlights the important role of framing mitigation activities as win-win or co-benefit approaches. This section explains how climate change mitigation relates to health and presents case studies of co-benefits or win-win approaches from mitigation actions. It also refers to the Health Impact Assessment, HIA, as the main tool proposed to assess the health impacts of any mitigation policy, measure, programme or project. According to the IPCC Fifth Assessment Report, AR5, climate change mitigation is a human intervention to reduce the sources or enhance the sinks of greenhouse gases, GHGs. The report also assesses human interventions to reduce the sources of other substances that may contribute directly or indirectly to limiting climate change, including, for example, the reduction of particulate matter, PM emissions, that can directly alter the radiation balance, for example black carbon, or measures that control emissions of carbon monoxide, nitrogen oxides, NOx, volatile organic compounds, VOCs, and other pollutants that can alter the concentration of tropospheric ozone, O3, which has an indirect effect on the climate. Mitigation is relevant for the health sector, as reducing GHG emissions can be done in ways that promote and protect health. There are sectoral differences in emissions. This image shows total anthropogenic GHG emissions by economic sectors. Indirect emissions, on the right-hand side, are those that result from the generation of electricity and heat. Direct emissions by sector are on the left. The agriculture, forestry and other land use, AFOLU sector, emits the largest amount of direct emissions, closely followed by industry. Mitigation measures can also have positive health results, co-benefits or win-win. The WHO series, Health in the Green Economy, has been reviewing evidence about health outcomes from climate mitigation strategies in key economic sectors, including housing, energy, transport, agriculture and health sector facilities. Some examples are highlighted in this section. According to the latest WHO estimates, 4.3 million deaths globally were attributable to exposure to household air pollution, HAP, and 3.7 million were attributable to ambient air pollution, AAP, in 2012. HAP is a significant health challenge. Traditional biomass and coal stoves, used by almost half of the world's population, cause major negative impacts on health, mainly in relation to chronic obstructive pulmonary disease and pneumonia in children under 5. It is estimated that emissions of climate change pollutants could be reduced by about 0.4 to 0.9 billion tonnes of CO2 equivalent between 2010 and 2020, as a result of the dissemination and adoption of new, very low-emission biomass stoves or other clean fuel technologies, especially renewable fuels such as biogas, to households in sub-Saharan Africa and Latin America at the same universal energy access rate. This translates into the distribution of about 9 million stoves annually between 2010 and 2020. With 165,000 annual deaths, Indonesia ranks second amongst East Asia and Pacific countries in mortality attributed to HAP. Supported by the World Bank and undertaken by the Ministry of Energy and Mineral Resources, the Indonesia Clean Stove Initiative, CSI, aim is to scale up access to clean cooking solutions through capacity building, policy development, and support for selected government action plans. It hopes to introduce, in stages, affordable, cleaner, biomass-fueled cooking stoves to 24.5 million families. That's 40% of households across Indonesia. Benefits from the initiative will include improved health, reduced poverty and gender inequalities, and climate change mitigation.
Tungku tradisional itu dia asapnya banyak, sehingga itu kan mengakibatkan polusi dalam ruangan dan juga mengakibatkan dampak pada kesehatan yang masak, yang dalam hal ini ibu Dan seringkali pada anak-anak kecil, terutama juga bayi, karena kalau di pedesaan itu kan ibu-ibu kalau masak kan pasti anaknya dibawa di dekatnya. Kemudian selain polusi udara untuk kesehatan itu juga boros kayunya. Jadi karena boros kayu berarti kalau ibu-ibu harus cari kayu, dia juga harus mendapat beban yang cukup berat ya untuk mencari kayu dan membawa kayunya. Kemudian memang sangat penting bahwa ada promosi dan penyuluhan untuk supaya mereka menjadi lebih sadar bahwa ada kebutuhan supaya tidak terjadi polusi di dalam dapurnya.
Alasannya pakai tungku ini, irit, nggak pakai itu LPG kan, nyarinya mudah di kebun.
Ya saya cuman takut aja kalau punya kompor gas itu loh, kan anak-anak saya masih kecil gitu loh. Saya kerjaannya di sawah gitu loh, kan saya khawatir kalau nanti ada apa-apa di rumah gitu loh.
Antara 30–40% penggunaan energi di rumah tangga itu masih berbahan bakar biomasa. Oleh karena itu ya memang perlu kita lakukan sebuah regulasi, kita buat sebuah regulasi agar keamanan, keselamatan dan kesehatan masyarakat itu lebih meningkat lagi dengan penggunaan biomasanya, dengan kompor biomasa.
The diffusion of solar photovoltaic PV lights to replace kerosene lamps has multiple benefits. These lamps use a renewable source of energy and contribute to reducing GHG emissions. In addition, solar PV lights are affordable and support educational and business activities during darker hours, while averting injuries related to kerosene use and reducing respiratory diseases related to air pollution. The United Nations Environment Programme, UNEP Global Environment Facility, GEF, N.Lighten initiative was established to accelerate the global market transformation to environmentally sustainable lighting technologies by developing a coordinated global strategy and providing technical support for the phase-out of inefficient lighting. As part of its work, the initiative supports the penetration of efficient off-grid lighting products at country level, including solar-powered lights. The initiative is a public-private partnership between UNEP, Osram, Philips Lighting, the National Lighting Test Centre, China, and the Australian Government's Department of Industry, with the support of the GEF. Transport constitutes 14% of direct GHG emissions. Integrated urban planning that supports cycling and walking is a key approach to cutting GHG emissions and increasing public health, according to the IPCC. The public health benefits of such active transport include improved fitness and mental health benefits from spending time outdoors. Inactivity causes 9% of premature mortality. If inactivity decreased by 25%, then more than 1.3 million deaths could be averted every year. Globally, physical inactivity causes 6% of the burden of disease, from coronary heart disease, 7% of type 2 diabetes, and 10% of breast cancer. So, urban planning and transport policies at the local level are part of the answer in order to support individuals to change their behaviour and increase physical activity whilst reducing GHG emissions. Brazil has the fourth largest urban population after China, India and the US. Faced with the challenge of a rapid increase in urban population, the city of Curitiba, the capital of Parana state in Brazil, has taken an innovative approach to urban and transport planning and has extensively developed its bus rapid transit (BRT) system. This efficient public transportation system, similar to a surface subway, reduces traffic congestion and air pollution, which threaten public health. Curitiba's fuel usage is 30% lower than in Brazil's other major cities. Excessive fuel use due to severe traffic is much less than those in Sao Paulo, about 13 times less in per capita terms, and Rio de Janeiro, about 4 times less. GHG emissions have therefore declined. Furthermore, selected streets in the city centre have been limited to pedestrian use only. Green areas have also been developed and cycling has been encouraged. GHG emissions per unit of animal product vary greatly between production units. Different farming practices and supply chain management explain this variability. Increasing efficiency per unit produced has both environmental as well as nutrition and livelihood benefits. Mitigation in the livestock sector also aims to limit the impact of climate change on animals, such as the effects of heat and water stress, which in turn affect human health. Technical options for the mitigation of GHG emissions along livestock supply chains fall into the following categories. 1. Options related to feed supplements and management. 2. Options for manure management. And 3. Animal husbandry options. The health sector contributes to GHG emissions and pollutants in many ways, including the buildings it constructs and operates, the resources it consumes, and the waste that it produces. Significant health gains can be expected from mitigation interventions. For example, the use of natural ventilation, when appropriate, is a way to save energy as well as being an infection control measure. Building climate-resilient health systems may mean, in some cases, such as facilities in developed countries, implementing energy efficiency measures or promoting the use of renewable sources. However, in other cases, such as some healthcare facilities without access to energy, this may mean facilitating access to energy sources. For instance, up to 58% of health clinics in 6 African countries had no electricity at all. In such cases, women give birth in the dark, by candlelight, or by car headlights, which means that the health system is unable to effectively protect the health of the population. Climate mitigation measures, particularly those focused on energy technologies, could also help contribute to and address other key health and development goals, such as universal access to healthcare and achievement of the health-related MDGs and SDGs. Different organisations have developed ways to improve the health sector's sustainability practices. Healthcare Without Harm has initiated the Global Green and Healthy Hospitals Network that is composed of more than 500 hospitals, health systems and health organisations, representing more than 20,000 hospitals and health centres from 6 continents that are committed to reducing their ecological footprint and promoting environmental health. The network is based on the members' commitment to implement a comprehensive environmental health framework for hospitals and health systems, called the Global Green and Healthy Hospitals Agenda. This framework consists of 10 interconnected goals. Each contains a series of action items that hospitals and health systems can implement to promote greater sustainability in the health sector. The Health Impact Assessment, HIA, is a means of assessing the health impacts of policies, plans and projects in diverse economic sectors. It is the main tool for integrating health knowledge in decision-making. There are different definitions of HIA. WHO's definition is a combination of procedures, methods and tools by which a policy, programme or project may be judged as to its potential effects on the health of a population and the distribution of those effects within the population. Another definition from Karen Locke of the London School of Hygiene and Tropical Medicine is a structured method for assessing and improving the health consequences of projects and policies in the non-health sector. It is a multidisciplinary process combining a range of qualitative and quantitative evidence in a decision-making framework. The conduct of HIAs falls under Component 1, Intersectoral Governance and Policy, and Component 7, Management of Environmental Determinants of Health, of the operational framework for building climate-resilient health systems. The figure shows the standard elements of a health impact assessment. Conducting a health impact assessment is a multidisciplinary process. HIAs are used in many countries to assess their risks to a range of potential hazards, not just to climate change. Embedding a health vulnerability and adaptation assessment within an HIA can be helpful when this approach is widely used and well accepted. This figure provides a short overview of some of the many roles the health sector can play nationally and internationally with respect to climate change. Overall, health systems need to be strengthened to ensure that communities and regions are resilient to the risks of climate variability and change, with strategies, policies and measures explicitly incorporating climate change and with close cooperation across sectors. The sector also needs to assess the health benefits and potential harms of policies, measures and technologies to reduce GHG emissions and other climate pollutants. Furthermore, it is important that the health sector plays a role in demonstrating what it can do in relation to making the sector more sustainable. The health sector also needs to support national and international negotiations to ensure agreements promote health. Finally, the health sector's role can be strengthened by increasing the inclusion and visibility of health within nationally appropriate mitigation actions, NAMAs, and national communications, as well as encouraging the use of tools such as HIA to evaluate health impacts arising from mitigation activities.